Hi there, my name is Carl Renato, chiropractor and PhD candidate in vestibular rehabilitation. Recently I presented at the European Chiropractic Union conference in Cyprus, and one of my talks was about the role that we have in the management of dizziness conditions. In that talk I quoted a recent paper by Necton, Hawke and others, which is cited here. It was a great survey study looking at the utilization of various professions for the management of dizziness and balance disorders. Interestingly, only 4.2% of people with these disorders would present to a chiropractic office for management. Now the question can be, why is that number so low? Well, there could be a number of reasons. One of which it could be that the education and training that we have in this field is generally on the low side. Having taught in at the university setting, I can say to you that there's not a lot given to vestibular rehabilitation or vestibular physiology. Is it that we have poor affiliation with medical professions and balance centres? Is it that we're not involved with regulatory bodies? Is it that we don't have a lot of chiropractic research in vestibular therapy, dizziness and poor balance? Hopefully I can change that in years to come. Yet, despite the low participation numbers, the effectiveness of chiropractic is considerable when compared to medical doctors, ENTs, neurologists, psychologists, occupational therapists, osteopaths, and nursing practitioners, as you can see from a chart pulled from that particular study. And it looks at an odds ratio, and if anyone's not familiar with stats, an odds ratio is the ability to assess the likelihood that a respondent with dizziness or balance problems reports being helped by that specific practitioner. So in the case of chiropractic, it looks at, well, if you have an odds ratio of 1 or less than 1, it means that the odd or the ability for that person to be helped by chiropractic is generally unlikely. Or if they have an odds ratio of greater than 1, what that means is that chiropractic has a higher odd of helping. Obviously, the higher the odds number, generally the better the possibility that that person may be helped by that particular intervention. Interestingly though, when I look at this study a little closer, it looks at if your dizziness was caused by head or neck trauma, chiropractic has an odds ratio of 9.5 compared to an average of 0.53, so that's hugely favourable for chiropractic. If it's a neurological musculoskeletal cause, 13.78 odds ratio compared to an average of 2.94. However, if there's an inner ear problem, the odds ratio for chiropractic is 0.7, which is considerably less than the average. So at our upcoming Brain Hub Academia seminar, Advanced Protocols for the Dizziness Patient, we discuss the physiology, the assessment and management for various causes of dizziness, including cervicogenic, concussion and vestibular pathology. Because one of the goals that I want to have is collectively that we can enhance our position as primary care practitioners when it comes to managing a relatively common yet often debilitating condition, the myriad of balance conditions. So we're presenting in Melbourne, August 5-6, Sydney 19-20 of August, and Perth, September 16-17. Limited seats are available and you can purchase them at brainhubacademia.com. So www.brainhubacademia.com.au. Early bird will be closing very soon. Hopefully this is giving you a taste of things to come. I'm going to be producing some more videos soon on different areas within the course that might be of interest to you. So look forward to seeing you and sharing this information with you soon. Thank you.